During the COVID-19 pandemic, I remember treating a patient who had a life-threatening drug overdose who was brought in by paramedics. They told me that they found this middle-aged man face down in an alleyway who was unconscious, not breathing. His face was pale, his lips were blue, and his initial oxygen saturations were in the 40s. And so they gave him 3 doses of intramuscular naloxone with no response. So they wheel him into the trauma bay and he is completely comatose. He's not breathing. The paramedic is actively ventilating the patient with a bag valve mask. And so we insert an IV and we give him a 1 milligram dose of IV naloxone as a Hail Mary as we gather equipment and get prepared to secure his airway and put him on life support. And just as we're about to push medications to intubate him, the naloxone kicks in and he starts to wake up. And so he's groggy, he's kind of opening his eyes, looking around the room, gathering his bearings, and I come to the bedside, I put my hand on his shoulder, and I say, hey, you had a really serious drug overdose, but you're in the ER, and you're going to be okay. And so he looks at me, makes eye contact with me, and realizes that I'm Asian, and says to me, don't fucking touch me, you fucking chink. I don't want a fucking chink doctor touching me. And this just goes on and on and on. And so I think that there are very few jobs outside of healthcare where you genuinely want the best for someone and you'll do your best to help them. And the response that you get is verbal abuse and sometimes even physical threats or harm.